Welcome back. You're still watching Morning Cafe, and now today we commemorate the World Contraception Day, a day that is set aside to highlight the importance of contraception and family planning, as well as educating on available contraception and at the same time help the youth to make informed decisions when it comes to their sexual reproductive health methods. And you can be part of that conversation. Our SMS line, interact with us on WhatsApp. Our number is 0793-267-279, 0793-267-279. That is our WhatsApp number. It is also indicated at the bottom strip of your television, as well as you can also call in and ask your questions, as well as chime in on this conversation. 0768-095-491 is our calling number, 0768-095-491, and also interact with us on our social media handles at TV47KE on Twitter, that is X, and TV47 Kenya on Facebook. The hashtag is a Morning Cafe. And to have that conversation, I am joined by Dr. Kireki Omano, who is the president of the Kenya Obstetrical and Gynecological Society at the Kenyatta National Hospital, as well as Faiza Acheng will be joining us in a moment. She is a mobilizer of Cibros of Zion and a mother also. Daktari, welcome and thank you for creating time.
Thank you very much for inviting me to the studio.
Anytime. How are you doing this morning?
Niko salama kabisa. Yes.
Today is the World Contraception Day. What does this day mean, and what is it that it brings to the table to the people?
I think, first of all, thank you very much for inviting me to the studio to talk about this very important topic. When you talk about contraceptives, basically what we are thinking about most of the time is to stop getting pregnant. But actually that is not the case. Usually contraceptives are interused. When you talk about family planning and contraception, people use them, interchangeably. Not always the case, and it should not be that way. When you talk about contraceptives, something I would like to sort of inform the public is that the first contraception, when you talk about hormonal contraception, was actually put into use in the 90s, in the 1960s. That was when the first pills were actually produced. And from there, this is about 60-something years, and they have been used every day. Every day, about 100 million, almost 200 million women actually use a form of contraception every day. It is a good thing, in a way, and contraception can be used in very many different situations. Apart from just spacing the family, we can also use contraception for other things as well, as medicine. Even though some people don't take it as medicine, we do use it in some diseases. For example, like in endometriosis, we actually use contraception. Combined oral contraceptive pills can actually be used to treat endometriosis.
Mm-hmm. Great. And what are some of the misconceptions or myths about contraception and that are frequently encountered in your practice, and how best can these be addressed then?
First of all, even before talking about the myths, maybe about the methods of contraception, and then we can go to the myths. There are many different types of methods. Some of them are effective, some of them are less effective, and others practically don't work at all, even though some people think that is a very good method. If so, we can start from the beginning. They are what we call natural methods of contraception. What methods are these? There is what we call a Billings method. Billings is a couple which actually came up with that method, and the idea behind it is just for the woman to monitor her cervical, her vaginal discharge, and normally around ovulation time, that discharge is clearer, it's sticky, and it's mucus-like. So if a woman wants to get pregnant, then that is the time she should actually try to get pregnant. But if she doesn't want to get pregnant, that is the time she should avoid having intercourse. So that is a natural method. The other method is a withdrawal method, what is called coitus interruptus. people say it's a method, but it's actually not a method, because most of the time when a couple are having intercourse, even before the man ejaculates, there is some little, fluid that is pre-ejaculatory, and actually in that fluid there can be sperm. So a couple can say, we have been using this method, coitus interruptus, but we still got pregnant. Failure rate of that method is actually 98%. So if you're going to use it, you are sure to get pregnant, 98%, I mean, all things being okay. But that is also used as a method. The other method is where a woman is supposed to observe her cycle for about 3 to 6 months. And this is very laborious because it has to be done every day in the morning. At the same time, she has to measure her temperature and then put it on a chart such that we know that when she's going to ovulate, her temperature increases by about 1 degree. So if you do that for 3 to 6 months and you have these records, then you will know that when it comes to a certain day in the month, I should avoid, having intercourse if I don't want to have a child. A method which doesn't work very well, because if you have, for example, a common cold and there's a fever, then that method is actually thrown into disarray. Then there are other methods which are very common. For example, for the men, we have the condom, which is used, quite a lot. Actually, when you talk about contraception, the first thing that most people think about is a male condom. We also have a female condom as well, even though the female condom is very laborious to use and not very accepted worldwide. There is what we call a diaphragm, which a woman inserts inside the vagina, and it goes and blocks the cervix such that when she has intercourse, no sperm can actually go through. Again, very clumsy, because if you're going to have intercourse, your partner is going to feel it, and it's not a very comfortable method of use. We have spermicides. There's a cream that you can use, before having intercourse, and so on. There are other, and then you come now to other methods where you have pills, combined oral contraceptive pills, as well as what we call progesterone only pills. This is also a method which has been used quite a lot. And unfortunately, some of the patients that we see actually overuse what we call the morning after, or the emergency pill. You can't have an emergency every second day. Mm-hmm. You can't have an emergency every week. So actually this is a pill which has been overused to the detriment, unfortunately, of these young ladies who use it. Then we have an injection, what we call Depo-Provera, which a woman uses every 30 days, and there's another one which they can use every 3 months. We have an implant which we place, on the arm of these ladies, and which is very convenient, because you use it for 3 years, even up to 5 years, and you don't have to worry about contraception. Then we also have what we call intrauterine contraceptive devices. That is the IUCD. There's the copper coil. Then there is another one which has what we call a hormone. It's impregnated with a hormone. And then apart from that, we also have permanent methods of contraception, where we can actually cut the tubes, as it were. And for the men, of course, we have a big problem with our methods of contraception, and that is vasectomy, which has a very, very low uptake in this country. When it comes to myths, there are very many myths about...
just before even you go to the myths,
yes.
There's the morning after pill,
yes,
which is the most used probably method by most youth and Kenyans right now.
Abused, yes. Horribly abused.
And
yes.
There are times when people use it, but
yes.
they still get pregnant.
Yes.
Do they fail, or what actually happens?
First of all, what we have to understand is that there is no contraceptive method which is 100% safe in the sense that when you use it, you will definitely not get pregnant. I mean, even vasectomy, we have seen cases whereby a man has vasectomy, and then later on we hear that the wife is pregnant, you know, or the partner is pregnant for that matter. There have been cases whereby we have also cut the tubes, and the woman has got pregnant, for example, has got an ectopic pregnancy. So there is no method which is 100% perfect, with completely no side effects and no failure rate. What we look at is what we call Pearl's Index, and this is basically how many women get pregnant in a certain period. So 100 women, if we take 100 women, how many of them will get pregnant using this method in a certain period? So some methods have a very low Pearl's Index, and others have a very high Pearl's Index.
Thank you. And Faiza, thank you for joining us. Welcome. How are you doing this morning?
I'm good.
And it's the World Contraception Day, and you are, perhaps tell us, what's your story with contraceptives as we start?
Okay. For my story, speaking out of experience, okay, I was using like this thing called injection. And ikakujika misbehave kidogo. So since you are here, nataka uniambie like mbona kuna some contraceptives na misbehave, like unaweka uko sure then after all unapata mimba, vitu kama hizo. Most of injection and the 5 years implant.
Okay. Just like I said, there is no method which is 100%. Hata madawa ukitumia, hata kama ni paracetamol, kuna wengine ambao paracetamol ukitumia inawasaidia, kuna wengine wakitumia paracetamol haiwasaidii. So vile vile pia ukitumia, kama wewe unasema ulitumia injection na haikufanya kazi. Injection kwa kawaida huwa inasaidia sana. And actually ukiangalia kwa upande wa dunia, most women actually use an injection. Why? It is convenient, it is cheap, unaidunga mara moja, unasahau, and so on. Unlike tablets which you have to remember, kila siku lazima ufanye nini? Lazima umeze tembe moja. Sasa inategemea. Pengine wakati ambapo ulidungwa hiyo dawa haikufanya kazi vizuri vile ambavyo ilikuwa inatakiwa kufanya. Pengine kulikuwa na shida tofauti. Pengine kuna watu wengine ukitumia hiyo dawa na utumie madawa mengine inarudisha chini ule kufanya kazi kwa hizo dawa. So there can be different reasons why such medications did not work or did not work properly. Kwa maana kuna wakati mwingine tumezalisha kina mama ambao walikuwa na coil, na katoto kametoka na coil, kanatoka na coil. So sometimes it has happened, unfortunately.
And perhaps even as you tell us more about your journey with that injection, and also was it easy to access it from where you are at that point?
No, most so in public hospitals. Health provider attitudes, like ukienda upate like as 17-year-old unaenda family planning, the doctor harasses you, anakuuliza you are just 17, what do you want to plan? Na anakunyima for that reason, anakunyima na kwambia you are still young, go and abstain. And for me, najua I'm sexual active, nataka hiyo nijiprevent nayo.
Okay.
So tutafanyaje as provider watu accept sisi wa 17 years old tukiendea service, tunaweza pata easily jua tuna hiyo pesa ya kwenda private. No, private nitapewa, they are very friendly, youth centered, but public at easy access. Na unaelewa in Kenya ma youth wengi hawana job and they don't have that money.
That is true.
So tutafanyaje as provider ukwe friendly na youths to avoid those unwanted pregnancy, STIs.
It's I think Dr. will answer that, and also speaks to the whole stigmatization of the contraceptives.
Yes.
So what are you doing to perhaps create awareness, also educate the young people who are trying to access these methods, and also bridge the gap between the doctors and the patients who are trying to get them?
I think you have raised a very, very important issue. Issue ya kwenda hospitalini, alafu na issue ya youth kupata dawa. Now that is a very thorny issue. But even before we go there, there is what we call unmet need. What is unmet need? Unmet need is basically women who are in the reproductive age between 15 and 49, who are actively, sexually active, who want to use a contraceptive method but are not able to get that contraceptive method. When you look at unmet need in Kenya today, it's about 40-something to about 30 to 40-something %, meaning kina what you said, kwamba unaenda hospitalini unataka kupata hiyo dawa lakini unaambiwa kwamba we you are 17. That is actually legislative, unfortunately. And what do I mean by that? According to the laws of Kenya, until you are 18, you are actually not supposed to get contraception. Which is a bit paradoxical and controversial. Why? Because if you look at the statistics that we have, about 200,000 young ladies in that age, about from 14 to 16, were actually pregnant in 2021, 2022. 200,000. And where does this place us? It places us in number 2 or number 3 in the world when it comes to adolescent pregnancies. Is that a good space? No, it is not a good space. Why is this not a good space? Because by the time you're 14, 15, 16, shule haujamaliza. Sawa sawa. Na umepata ujauzito. When you go to deliver, you forget about school for some time. Kazi hauna. So taking care of this child becomes a problem. Alafu sasa, you don't have any skills to offer an employer. This baby will grow most probably in the same environment, nae ataenda most probably we also have the same problem. So what are we creating? We are creating cycles of poverty, unfortunately. So I totally agree with you kwamba wakati unaenda kwa daktari, unaenda kwa hospitali za umma, unasema sisi tunataka dawa ya kupanga uzazi. Na unaulizwa, not necessarily by a doctor, by a health worker, wewe unataka kupanga nini, and you are 17. Lakini kile ambacho wanasahau ni kwamba as you are sexually active, unaweza kupata mimba. So it is a bit controversial. It is a big problem that we have in this country, and we need to address it. We need to address, and then apart from that, kuna wengine who are 17, 18, okay, 16, 17, and they are in a relationship na wamezaa kwa mfano. And they go and say, you know what? I know the perils of bringing up a baby. I don't want to have another one. Can I have contraception? Pia hao wanaambiwa la kwamba hawezi kupata. So we have a problem with that, we have a challenge with that, and the challenge is basically legislative, not us as doctors. Yes. You asked what are we doing to create awareness. This is one of the things that we are doing to create awareness. That is number 1. And then number 2, something which I would really like to emphasize. In as much as at 17, 16, 15, you start having intercourse, lazima muelewe kwamba mukifanya ngono kuna uwezekano kwamba unaweza kupata mimba. And your biggest business ni kwenda shule, sio kufanya ngono. That is your biggest business. Nenda shule. Sawa sawa. Kwa maana when you start doing this and you get pregnant, the problems that come after that are actually, you are actually children giving birth to children. Sasa inakuwa ni vigumu sana.
Yeah. And Acheng, I understand that you run some organization called Cibros. Yeah. What is it that you do, and from your experience, how are you helping young girls access contraception, and also at the same time advising them on the right time to engage in such issues?
Okay, I'm working with Cibros, Cibros of Zion, meaning Sister and Brothers of Zion. So the most thing, or our objective ni to reduce unwanted pregnancy na kuona madams wame access contraceptive in a safe way. So kitu ni inspire ni work na Cibros was like I was harassed na health provider nikiendea contraceptive. So nikasema kama mimi ndo nimekuwa harassed hivi, most of the girls pia wanapitia the same thing napitia. That's why I approach our director Collins, kamwambia I want to be a mobilizer in our community. I want to mobilize young girls wenye wako sexual active, ni wapeleke facility, wapate service safely. Yes. So Cibros tumepatana na private hospitals juu tumeona public they harass youth. So tunafuta those health centered or youth centered tunaenda public, tunawarefer. And another thing daktari, in most public hospitals tukienda kupata service, I think there is something inafaa kufanywa, like wanapima una react na gani, unafaa kupewa gani, na hawafanyi hivyo. So hapo na utanijibu mbona mfanyi hivyo. Unapata msee anapewa injection, anaenda ina react na yeye vibaya, akienda atolewe kwa public anaambiwa si ulitaka. So that's why tunapeleka private, at least it's a bit friendly na my youths.
Okay.
So kwa community tuna identify the sexual active from 15 years to 19 years. Na tunawapea service, na hapo pia tunawapea points. Juu unapata most of them wako very vulnerable, they can't afford pads. Na kama mdema hizi access ama afford pad, ataenda kwa mwanaume ampe 50 bob, aenda nunue pads, then akuja afanye nini, alale naye. Hapo result itakuwa it's either HIV ama mimba. So tunawapeleka huko, after kupata service kuna points tunawapea. Ina like HIV testing tunawapea 100 points. 100 points anaweza access kama pad, aenda chukata pad mbili kwa chemistry ama whatever maduka, na kuja jisaidie nayo. That's the main thing tunafanya kama Cibros of Zion. Na pia tukipata teen mothers wenye parents wame neglect, yani wameachwa kabisa na parents juu walipata mimba au disappointments parent wana feel, tunawapeleka kwa vocational training like tailoring. Most site tuko na tailoring most of. Yeah, so daktari, question yangu ni mbona tu mtu akireact na contraceptive na atolewi? Anarasiwa vibaya sana, unapata anaenda up anakana hii kitu lakini anakonda. Mwingine ana bleed, vitu kama hizo, lakini akienda public haizi pewa ile service poa.
Okay. Nafikiri umeuliza swali zuri sana. Ni kwa sababu gani ukienda public kuna huduma fulani huwezi kupata vizuri, ama ukipewa hizo huduma kuna mambo fulani wanawaambia ambayo sio mazuri. Kitu cha kwanza, kabla hata kupewa haya madawa ya kupanga uzazi, inabidi kwanza tuchukue historia. Na miaka mingapi umewahi kupata mimba, hedhi zinakuja kila mwezi ama hazikuji kila mwezi, na vitu vingine. Na kwa kawaida inatakiwa kwamba tupime damu, tujue kiwango cha damu, tupime tuone kwamba mwili unafanya kazi vizuri, tupime hata pressure, tujue kama pressure iko sawa na vitu vingine. Tukisha maliza kupima hivi, ndipo sasa tunakuelezea zile mbinu ama methods ambazo ziko available. Kuna hizo tembe za kumeza, kuna sindano, kuna implant na kadhalika. Sasa kuna uwezekano kwamba wakati ambapo tunaenda hospitali ya umma, unakuta una sindano peke yake, hatuna hizi options zingine. Kwa hivyo unadungwa sindano kwa sababu hospitali za umma hazina njia zingine, hazina tembe, hazina implant, unakuta ni sindano peke yake ziko. Na kwa kawaida inatakiwa kwamba hospitali za umma ziwe na hizi dawa zingine zote, ziwe na madawa, vidonge vya kumeza, implant, hata hiyo coil, kila kitu. Alafu sasa tunakuambia kwamba tuko na hizi ndizo methods ambazo tuko nazo. Unafikiria ni method gani ambayo itakuwa nzuri kwako? Sawa. Kwa mfano ukiwa umedungwa sindano, umeuliza kwamba unadungwa sindano, una react, pengine unatokwa na damu na vitu vingine. Hiyo inaitwa side effect. Ukidungwa sindano, kama hiyo kudungwa sindano, inajulikana kwamba kina mama ambao wanatumia sindano watakuwa wakati mwingine wanatokwa na damu in between the periods. Hiyo inajulikana. Na kitu kingine ambacho kinajulikana ni kwamba ambao wanatumia sindano kuna shida zingine ambazo wanaweza kupata. Kuumwa na kichwa kwa mfano, unasikia ni kama umechoka, ile hamu ya kufanya ngono pia inarudi chini na vitu vingine. Kwa hivyo ukienda hospitali za umma, ile ambayo umepata ndio unapewa. Na kitu kingine, kwa mfano ukiwa umedungwa sindano, hatuwezi kutoa hiyo sindano kwa maana imeingia kwenye system, kutoka itakuwa ni vigumu, haiwezekani. Kwa hivyo hata kama kuna side effects, hakuna kitu tunaweza tukafanya. Tutangojea tu mpaka mwili umalize kutumia hiyo dawa, ndipo tutafute njia ingine ambayo tunaweza kupatia.
Thank you so much, Daktari, for that. And of course, time now to take a short commercial break. We'll be back with more, but of course, keep interacting with us on WhatsApp. Our SMS line, our WhatsApp number is 0793267279, and you can also call in to ask your questions as well as chime in on this conversation. 0768095491 is our call-in number. We take a short commercial break. We'll be back with more. Stay tuned. Welcome back. You're still watching Morning Cafe, and the conversation here is concerning contraceptives, even as the world commemorates the World Contraception Day. And Dr. Omanwa, I'll start this. There's someone who is asking how effective is a birth control patch?
Very effective. Actually, that is one of the methods of contraception, has been around for about 20 years or so. And the patch contains two hormones, which are similar to the hormones which are in the tablets. It's a very convenient method because you just stick it once and you remove it every 7 days. So you have 3 patches which you use. After 3 weeks of using, you have 1 week's break, and then you start all over again. Where do you put it? You can put it anywhere on the body except on the breasts. That one is not allowed. The only thing is that sometimes, say for example, you are somebody who goes to the gym and you sweat a lot, that can actually lead to the coming out of the patch. It can dislodge itself. And if that happens, then we have to throw that away and start, on a fresh patch. The other thing is that it's not highly recommended for women who have a high BMI, over 30. Again, because of the surface area, which is going to be a lot, so the distribution is going to be a lot less. Yeah. So it is something which is very convenient, and I think it is available locally. So only that most people don't know about it, but it is there.
Yeah, and I see another question as well. Someone is asking, nauliza, how is 21 pills used? And ukimaliza, what is the next step? Or after kumaliza na ufanye sex, unaweza pata ball?
Okay, pills actually they are used for there are two types of pills. There are ones which are 21 in a pack, and the others which are 28 in a pack. The ones which are 28, you have 21 active pills. The other ones are just dummies. They're just, most of the time, they're what we call hematinics. Why is it that? Is that because once a woman starts using these pills every day, there are some who don't want to sort of break that rhythm. So they continue using for 28 days, but the active ones are 21. When do we start using the pill? There are different methods of actually starting using the pill. Most of the time we start on a day 1 or day 2 or even day 3 of the cycle, and you start, most of them actually have arrows, how you actually use these pills until you finish the pack. Then there is something which we call, you can start at any time. Say for example, you have irregular periods and you want to start using the pill. Actually you can start at any time, especially when you have irregular periods. But most of the time you use for 21 days and you have a break of 7 days where you have what we call breakthrough bleeding, and then you start all over again. Now, there are also other different ways of using it. You can actually even use it for even 3 to 4 months without any break, and then you have a period, 3 or even 4 times in a year. We suggest such a method of using the pills in patients who have very heavy, very painful periods, or patients who have a lot of pain. For example, what I mentioned right in the beginning about endometriosis, where you don't want this pain to be there as often as possible. So we want to reduce the number or the amount of the frequency of the bleeding.
Mm-hmm. Well, thank you for that. And even as I come to you, Acheng, once the injection failed, what method did you seek, and what do you mean by it failing? What did it cause later? Is it an infection, or did you get pregnant, or is it a virus later?
Okay, let me start. I became sexually active at the age of 15 years, and my mother could not accept this. My parents were very against it. So nilienda kwa kuuliza mabashi, that peer pressure unasikia. Hey, I'm using this injection. By that time I don't have any knowledge about contraceptives. So niliambiwa enda tudunge injection ama nini itakusaidia. So kuenda juu ya ile peer pressure, I was in Form 1 that time. Juu ile peer pressure nikadungwa injection. Simi sana jua after injection I can do it freely. Okay, though unajua youths wanaogopa mimba kuliko ukimwi, so nasema at least nipate ugonjwa but nisipate mimba, so nime prevent ball. Nikaenda hivyo mpaka Form 3 nikitumia tu injection. So immediately after Form 4 bado nimeweka injection but najipata niko mimba, so niko luzleza. How come nimepata mimba na natumia family planning? So sikujua inaweza fail, na pia sikuwa any knowledge, na sikuenda hata kuuliza nini and hata kuna mtu alijua nimeweka.
Kwa hivyo wakati ulienda kudungwa sindano hakuna mtu alikuelezea kwamba inaweza ikafail, kwamba unaweza kupata mimba hata wakati ambapo umepewa dawa?
Hata side effects hakuna. Hata ukibleed unaambiwa itarudi tu normal. Hiyo tu ni body yako ina react for like 3 months. After 3 months you will be just normal. Nilika tu hivyo like una bleed but si less sana, unaweza unaenda for 1 week ama in a month una bleed hata for thrice. Like unashindwa rada. So after that ndio nilikuja nikapata mimba immediately after Form 4 and it was not planned. Yeah. So nikauliza daktari mwenye aliniwekea, how comes I'm pregnant na natumia contraceptive? Kaniambia kwani hukujua inaweza fail? That's the thing aliniambia, kwani hukujua inaweza fail? Wait, after kuwekewa muenda tu kujiachilia, ujui kitu iko na side effect nini. Kaambia sikuwa najua. Mabeshte wale wenye walini advice ndeni yake wakaniambia hiki kitu na failing, kwani wewe uko unajuanga? So unaniambia after ikisha happen ina failing, kwani ujuangi? So nikasema wakaniambia sijui ndio umeze e-pills packet 3 mimba itatoka. Nikuziliza packet 3 mimi na dawa no. Nikasema nikimeza it's either unaweza bleed ukufe ama kama uko na bahati poa unaweza baki. So nikasema heri tu nile mimba yangu. At least ni avoid hiyo kukufa, hata mimi sikufa sai. Na hata mimi mamangu angeenda ameze hiyo packet 3 singekuwa. So niliona tu heri tu nile mimba hadi nizae. After kuzaa ndio nikakutana na hiyo fibroids. So ndio wakatufunza about contraceptives, wenye mtu anaweza jitekea kama uko sexual active na wale wenye yuko sexual active, na hata usiende ukadanganya wengine. Ni kama like niseme aje, ni kama unalipisha kisasi. Juu mimi nilifanyia hivyo, yeye pia nataka ifanyikie hivyo, asimalize shule.
Thanks for that. And Doc, there's so many myths and misconceptions around different kinds of contraceptives. Talking of an example of an implant, some say it lowers the libido. Is it true? And also, there are side effects that come with it. Some people gain weight, others lose weight. So how do you know which is the right one for you?
Okay. I think, first of all, like I explained right at the beginning, the most important thing is to talk to the patient. So when the patient comes, we need to get a very good medical and surgical history. We need to understand about her periods. Are they regular? Are they irregular? And if they are regular, how are they? Are they heavy? Are they painful? Are they clotty? And so on. So we get the history, number one. Number two, the reproductive history. Have you ever been pregnant? Do you want to have a baby? You know, and so on, because they come with the different reasons. Now, if in the case of contraception, once we have done that and the patient says, I want to have contraception, now this history actually does help us. Why? Because if she is on some medications, some contraceptives will not help her. They will be less effective. If, for example, she has not delivered, we may not essentially put a coil in her, because actually by doing that, we can even be giving her some infection, or through the vagina while inserting the coil, we can actually lead to some infection in the womb, which is not good for her. If she has medical issues, for example, she has high blood pressure, she has diabetes, she has had surgery, heart surgery, brain surgery, she has had a clot in the past, you know, and so on. These obviously do not qualify for certain methods of contraception. Now, once we have to end in BMI, for example, if she has a BMI, there are some contraceptive methods which will not be applicable for her. Is she a smoker? These days, ladies say, whatever men do, we can do better. So if you are smoking, that is also a problem, because in the cigarette smoke, there are very many chemicals, which, ukitumia, for example, tablets, can actually affect you later on. So we need all this information. Now, once we have got this information, then we go to the next step. We need to do a scan, ideally, in the ideal world. But like somebody said, our dreams are valid. We hope we'll get there one day. We need to do a scan to look at her womb and to look at her ovaries. Then ideally, again, in an ideal world, we also need to do a blood test. To look at her hemoglobin level, and ideally we should also do what is called a clotting screen, how the body clots, because if you're going to introduce hormones into the system, if the clotting screen is not okay, it can also lead to complications later on. We also need to check her liver. We also need to check her kidneys as well. Why? Because these medications are broken down in the liver, and then they are excreted through the kidneys. So if the kidneys are not working well, there are medications which we can't use. If the liver is not functioning well, there are medications which we can't use. So once we have all this information is when we sit down, ideally, again, as I said, tuseme sasa uko hapa, tuseme this is what we have, achieng, and we think this would be the best method for you. That is what we are supposed to do. Do we do it? Most of the time, like you said, ulikuwa unaenda hospitalini, wanakudunga tu sindano, because number one, they are short of resources. Number two, they are short of medications. Number three, there is a shortage of funding. So you cannot be able to do all this, you know, in order to arrive at the correct or the most suitable contraceptive method for a patient.
Okay. And I see Sylvia from Zimmerman here is asking, family planning is one of the subjects that many people, especially men, hide their faces from, hence leaving everything to women. First, the doctor will do us a great favor by giving a brief highlight of each method, the pros and cons. I think that is something that was highlighted. Sylvia will be able to follow this conversation on social media and get that. And also, secondly, she's asking, according to the doctor's experience, which method that has less women getting pregnant after using it?
Thank you. Now, that again depends on the conditions that I said, that I put down. So if you look at 100 women who have used a certain method, whether it is combined oral contraceptive pills, whether it is the patch, whether it is the implant, or whether it is the injection, and so on. Now, the most common method that is used is basically tablets. A lot of women use tablets, and it has the highest, what you call Pearls index. It has the lowest Pearls index, whereby failure rate is between 1 and 3%. So if 100 women use oral contraceptive pills over 1 year, 1 to 3 of them will get pregnant, as opposed to other methods. The injection ambayo ulikuwa unatumia, it has a failure rate of about 4%. Which is also not very bad. Implant also has a failure rate of about 4 to 5%, which again is all. So these methods are actually very, very effective. When you go to other methods, for example, for the men, as you said, men, we hide from talking about this. At least as doctors, we don't. Men wakitumia condom, the failure rate is very high because the condom can come out during intercourse. It can also burst during intercourse. It may have holes. It may have all these issues which will lead to a high failure rate. The other methods, for example, ukitumia the coil which we insert, the normal coil, because there are two types of coils. There is a copper coil and there is what we call a coil which is impregnated with a hormone. The one which is impregnated with hormone, actually the failure rate is a lot less. It's about 1%. Kwa sababu gani? It works mechanically and it also produces a hormone at the same time. So it is one of the methods which is very, very successful if one wants to avoid getting pregnant. The common coil that we have has a failure rate of about anywhere between 5 to 6 to 8%. So relative to the tablets, the failure rate is higher, and relative to the other coil, the other coil which is impregnated with a hormone, is a lot more successful. Now, the other methods which I mentioned, the natural methods, that one is the one of withdrawal coitus interrupters. Failure rate is about 98%. You actually can't call it a method, but people call it people still call it a method, because somebody used an illustration and said this bus is supposed to stop at a bus stop, but then it doesn't stop. Unakuta imeenda tu. So by the time you reach the bus stop, the bus is supposed to stop. Unakuta imepita bus stop. So that one is not even a method. The other methods of checking your temperature every day, failure rate about 80 to 90%. Why? Because something small, an infection here, which will increase the body temperature, you have a fever here, it will completely disrupt it. So the contraceptives, the oral contraceptive pills, the injectables, the implants, the coils have a very high success rate, basically. And
I think from what you do at Cibros, is there a change of mindset from the people that you interact with in terms of using contraception? And also, in terms of numbers, what are the most prevalent contraceptions that these people are using? And also, are they working for them?
Okay, now in my community or in my area, like most of the youths prefer implant, the 5 years implant. It's very convenient for them. Then aina side effects mingi sana. Unlike pills, anasahau kumeza. Yeah. Coil, okay, this thing wako nayo, coil ati lazima uende na mzee apimwe ndio wekewe. So ana like mzee azienda. So I don't know if it's a myth or need.
It is a myth actually. It is a myth. Atupimagi wazee wakati tunaweka coil.
Then condom for this, sure, ya government here free ina bust sana sana, so wanasemanga condom is 68%, ukiangalia condom no ni za bust, it depends na friction, nasikia hivyo. So wana prefer sana hiyo implant ya 3 years na 5 years injection, au yuko sure na juu unaweza kosa hiyo pesa ya kwenda after 3 months kudungwa tena upate mimba. But hii implant ukikewa 5 years at least unaweza kwenda kuwekewa tena ni 500, at least hizo 5 years tukume save upate hiyo 500 uende wekewe. But Cipros tunaweka free, so once tumekuenroll kwa Cipros tutakuwa napata hizi zote free. But kwenye hatuja enroll unapata challenges sana. So far tumeshika hiyo area yote. I think mayouths wengi kama wana plan, wana family, wanapata contraceptives moso sana. Tunapata from age 15 years, dem ako sexually active, parent ajui, unamwambia I want your parent to know that unatumia this thing, tunasema no, parent atamfukuza. So ni jukumu letu kwenda kuongea na parent, we have a consent form, lazima parent assign ndio tupeleke that's a 15-year-old or si apate service. So ni ngumu tena kuongea na parent, na nakataa, unafunza mtoto wake vitu mbaya, unataka mtoto wake afanye sex, vitu kama hizo. So tunaongea naye, kikataa tunampeleka kwa director. Unajua at least ata understand director sana. Kuna vitu zenye mtoto hawezi disclose kwa parent, lakini anaweza kuja kudisclose kwa peer partner ama peer friend.
Okay. Doc, there's a question here. Yes. I have a question about the contraceptive topic today. I took depot contraceptive for 3 months at from May. I haven't seen my periods, just spotting. Currently, I'm not on any contraceptive.
Yes.
What can I do?
Nothing. Because usually what happens, whatever, if you're going to use hormonal contraceptives, whether they are tablets, whether it's an injection, whether it is an implant, or even if you're going to use the hormonal IUCD, what happens is that they block the natural way, they block what we call the cycle, what we call HPO axis. That is, the brain talks with the ovaries, and the ovaries release a hormone, and this hormone works on the lining of the womb so that you can have a period. So when ladies take contraception, hormonal contraception, these pathways are actually blocked. The ovaries don't work, so they don't release a hormone, and the lining on the womb doesn't come out. It will only come out because you have stopped taking that break in between contraception. Now, most of the time when they have used this, whichever method it is, it takes a bit of time for that cycle to restart again. So I would urge her not to panic. It is something which is normal. After stopping contraception or hormonal contraception, the body may take, because all bodies are different, there are others which may take a month, others may take 2 months, others may take 3 months, others may take slightly longer. And then again, something here which I need to underline is that the longer you take, contraceptive pills or hormonal contraception for that matter, it may take also a little bit longer for the body to start again the normal cycle. So she should not worry.
Yeah, there's also quite some interest on implants.
Yes.
There are so many myths and misconceptions surrounding that contraceptive.
Yes.
Some say it lowers the libido, others say it increases it, others say they lose weight, others say they gain weight from it. Yes. How effective is it, and why do we see all these changes within somebody's body when they use an implant? Yes. Okay,
very good question. And actually, you can actually extrapolate that question to all the other hormonal contraceptive pills or hormonal contraception. Kwa sababu gani? Originally, because you remember I said we need to check the kidneys, we need to check the liver to make sure everything is working well. This medication is actually excreted through the kidneys. Once it has been broken down, it has worked, it has to come out. Now, why do some women actually gain weight? Wakidungwa sindano kwa mfano, or with the implant, or even some with the tablets that they take. Yes. Why? It is because the hormones that are used there, they work on the kidney, and the kidney retains water. So what we actually see as weight gain is actually fluid retention. Now, there are newer methods or there are newer tablets which actually have a hormone which, instead of retaining fluid, it actually makes the kidney to release as much fluid as possible. So that is why you say kuna wengine wana lose weight, kuna wengine wana ongeza weight, kuna wengine sijui libido. Now with libido, again, this has been experienced especially in women who use the implant na wale ambao wanadungwa sindano. And that is because basically of the progesterone that is used there. And that progesterone actually can sometimes lead to lower libido. But it's not, again, in all women. And that's why, again, it is very, very important here to say and to underline that there is no one method that fits all of them.
Yes.
Every woman, and you know, women are very special. Every woman is different. We need to talk to them. We need to try and understand their physiology so that we can help them to choose the best method.
Acheng, even as we wrap up, is there a specific message that you'd like to share with others on this World Contraception Day to raise awareness as well as to educate people on the importance of being aware of the reproductive methods?
Okay, my last word, nataka ku-encourage mayouth sana sana, wasione kama unatumia contraceptive you are sexually active. Not all who are using contraceptives are sexually active. Tunajaribu tu ku-reduce to unwanted pregnancy. Usikue kama mimi. Kitu nimepitia sitaki wengine wapitie tena. So that's why nasema, if you feel like unataka kutumia condom, use condom. If you feel you want to use pill na ukushua uta maintain your time na date, tumia.
Na utakuwa na pesa ya kununua. But we give free. In Cibros tunapeana free. So mnaweza kuja Cibros. Cibros tunapeana hizo free. So wasione sana, like kama you know you are sexually active, chukua tu contraceptives, usilete mtoto akuja teseke hapa duniani. Tunafaa kupata mtoto kama tuko planned, kama unajua atateseka, ako sawa na umfunze vizuri. So tuseme tu tuna encourage tu watu contraceptives. Yeah, kama wako sexually active. And to parents, if you know your daughter is sexually active, usiignore, ashakubali yeye mwenye yako sexually active. Mpe tu hiyo chance ya kwenda kupata contraceptives. Ama mwenye umpeleke hosi apate. Ndio pia wewe avoid asikudisappoint apate mimba akiwa shule nini. Tunataka amalize hiyo career yake. So parents tukue friendly na wasichana wetu moso. Wanaume unajua hawezi pata mimba aje shule. Atakupea yeye continue na shule. Tusidanganywe.
Thank you so much for that, Acheng. And Doc, even as we wrap up, looking forward, what are the hopes and goals, and what is the future of contraception and health and reproductive health in Kenya? Sorry.
Thank you for that. First of all, contraception or even family planning is actually one of the most successful things in terms of public health that has helped. When we are able to plan our families, we are able to do many other things, because once a woman delivers, na najua kwamba she will not have an accidental pregnancy, she will devote time to this baby that she has delivered, she will do her work, and then after 2, 3 or whatever period that she wants, she can get another one. So this is immensely important for this woman, for that child or for those children, for the family in general, and also for the society. Family planning or contraception is not going anywhere. It is here to stay, and for a very long time. Now, what we need to look at, and what we need to look at very, very seriously as a society, is what happens when our youth become sexually active. And Acheng here is an example. What happens? What happens when they do have a baby, like what happened to Acheng? And Acheng doesn't want to have another baby, but again, according to the law, she actually is not supposed to access contraception unless it is sanctioned by the parent. Na yeye mwenyewe amesema kwamba parents don't want to talk about it. Ukienda kuongea anasema mimi sitaki mtoto wangu apate nini contraception, kwa maana unaanza kumfundisha mambo mabaya and so on and so forth. Yes. So we need to have a discussion, a serious discussion. The government, the healthcare providers, the churches, religious, religious entities, and then something else which I think we need to have is sexual education, but which is tailored to the various ages, because this is going